So now I'm going to talk about the treatment for personality disorders. Personality disorders are actually divided into 3 different clusters. Cluster A includes the schizoid, paranoid, and schizotypal. This is dramatic, emotional, or erratic behavior. Cluster B is the borderline, narcissistic, histrionic, and antisocial behaviors. Cluster C is the avoidant, dependent, and obsessive compulsive. This includes anxious and fearful behavior. To start, I'm just going to talk about generalized treatment for all 3 clusters. First off, drug therapy is often used. The most common types of drugs are the SSRI, the selective serotonin reuptake inhibitors. The next is the anticonvulsant drugs. And lastly, risperidone. Below is what each targets, as well as other names that it's found under. The best way to gain correct information about these drugs is to visit your local pharmacist, who can provide all relevant info and a printout regarding the effects, possible side effects, and dosage. Next form of treatment often used is psychotherapy. This involves group therapy with a registered psychiatrist. The purpose of this is the creation of interpersonal relationships in order to aid in the gain of one's personal well-being. Several different approaches and environments are used. These include group and family psychotherapy, cognitive behavioral, expressive therapy, and mixed therapy. The overall goal of all of them are understanding one's source of distress and recognize and change maladaptive behavior. Next form of treatment is the involvement in social clubs. Now, this can include living in designated residential settings, participating in therapeutic social clubs, or self-help groups. Examples of these include local support groups for mental illnesses, which can actually be found online based on the area in which you live, online forums in which people chat online, sports clubs, craft and book clubs, as well as hotlines, which can also be found online. Another form of treatment and option for personality disorders is enrollment in day hospitals. These day hospitals include a multidisciplinary team of healthcare professionals such as doctors, nurses, physiotherapists, occupational therapists, dietitians, and pharmacists who all work together. The environment is a therapeutic one in nature, so relaxing for the person. A main emphasis is on educational training about the disorder and the expected course of the disorder, as well as other treatment options. It's a very supportive environment through also the support of the professionals, as well as others experiencing the same disorders, in order for them to relate with one another. Additional treatment suggestions are now for the specific personality disorders, and I'm just going to list them off as they are on the screen. For cluster A, non-directive cognitive therapy. You want support in order to reduce isolation for the person. You want them to express their emotions, social skills training, and involvement in steady employment in order for in an interpersonally undemanding job. Next is cluster B. Social skills training is used again. Cognitive therapy, psychoeducation, tolerance of distress and learning to act and not act on impulse, self-management skills and organization, employment in order to keep one task-oriented, as well as social networks in order to develop interpersonal contacts as well as skills. Lastly, cluster C, encouragement of emotional expression and not keeping one's thoughts and feelings held inside. And lastly, time-limited dynamic therapies, which can be active and confrontational in order for them to get their feelings out.